why we need to continue. What I thought I'd do in the next just a few minutes is really tell you what we know, given what's been made public about what's happening in childcare in Nova Scotia. I know you all know there's a new ECE wage grid, at least ECEs know and directors would know. Actually, can you just flip to the next slide for 1 second? This is the wage scale that the government has released, and it is fairly inadequate, shall we say. In my paid job at the CCPA, I just did the living wage calculations, and if you did not see them for the current year, Halifax's living wage is at $26.50. So let's put these wages into context for a moment. I think that gives you a sense of why there is such frustration with the wage scale that has been released. What are we looking at here? Oh God, ECE level 1 is at $19 an hour. I mean, back in 2015, our living wage was past $20 an hour. So our directors at the fourth step are barely making a living wage, director level 1. And I mean, the other thing that we've noted, and there's been this amazing work done in BC on understanding why it's so important to address pay inequity when you're building these wage scales, but to address not just education, but experience. And one of the messages that we've been trying to send to government is why it's so critical that we are retaining and ensuring that we are valuing the work of those who have been in the sector for a very long time. And one of the clear criticisms of the wage grid is that it does not recognize those ECEs who have been doing this work for a very long time. And it needs work. It needs us to continue to advocate. Can you go back, Kenya? There's been no pension announcement. We understand something might be coming. And so perhaps that can be part of our discussion if others know what might be happening on that front. I, looked again at the most recent bilateral document through the Government of Canada site, and there is an updated bilateral agreement to 2026, but there's still no report from our Nova Scotia government on what they've achieved so far. And I mean, I put the links there. What we'll do is we'll make sure that we share these slides with you, and you can have a look at these things yourself. You can try and decipher through the bilateral agreement what some of the targets are, and there are many, and I've only pulled out some of them. One of them, in terms of training, is that 70% of staff in licensed childcare and early learning programs will have at least a diploma level of education. And there's targets in there in terms of providing support for training, professional development, and that kind of target support. Can you flip past the wage grid into the next one? The other side, of course, is, in addition to understanding what's happening in terms of ECEs and their wages and compensation framework, is the fees. As Kenya said, our government did what is likely the easiest part of this agreement, which is to cut the fees by 50%. And I just wanted to underline that the 50% is 50% of average 2019 fees. And then this is the most recent, well, this is what I found on the website, which really means if you look at the last column that says total average 50% fee reduction, that means that's what parents have left to pay. So $23 per day for infant care, $18.25 for toddler care, and on it goes. And apparently, if you can get access to it, $10 a day, full day school age before and after. So that would be PD days, before and after care. And I can tell you, because part of doing the living wage is actually trying to figure out what is available across the province, and so few communities across the province. I mean, other than Halifax, I don't think before care is available. For many communities, there's a little bit of after school care, but we could hardly find any PD day coverage. And outside of HRM, there's very little summer coverage, March break coverage. Like, I mean, think back to what Kenya shared, and that's what parents are doing for all of those other times that childcare centers are not open or not available in their community. So obviously this is regulated licensed care if you are able to get it, as Kenya said. Next slide. So in terms of fees, their target has been extended to March 2026 for the $10 a day. At least that's what the current bilateral, the updated amended agreement says. And that's for all regulated spaces. They do also have targets. We do have a childcare subsidy program, and they have targets for increasing the number of children who receive the maximum subsidy. And part of their target is for some families to be not paying anything at all. The childcare subsidy program currently, in order to get access to the maximum subsidy, your adjusted household income has to be below $35,000. That's a pretty low adjusted household income. And with that adjusted income, there's 5,264 children in that program, 28% of whom earn over 35,000, which means they wouldn't be receiving the full per diems, but would receive some depending on where they are on the spectrum. In terms of the living wage, anybody earning a living wage would not get access to any of the childcare subsidy because that income is far too low. Next slide. So childcare spaces, Kenya gave you some numbers. This is one of the frustrations, is that government, we were hoping there would be an annual report so they would actually lay out what they're talking about, because we have found that they sometimes talk about before and after school, or the after school program, as if it's a space, a full space that a family gets access to in licensed care. And so there's been some slippage around what numbers are we actually talking about, and are those net spaces? How many have we lost? So it has been difficult to get a sense of what is happening, but here's what we know. In the bilateral, the language is that they are committed to moving to a fully not-for-profit system. They put $10 million into a fund to transition support for for-profit childcare in the province. They've been asked to provide a baseline of where spaces are at. This is the baseline that they had in there. So as of 2020, there were 348 licensed childcare centers in Nova Scotia with 1,668 licensed spaces. I don't know if that's actually their baseline. Their target is sort of 9,500 spaces for birth to age 5. But they have this little note that says that their target is actually 59% coverage based on some needs survey that they've done. I don't know what that is. And that to reach 59%, they actually only need 2,400 more spaces. So part of what we commit to is trying to keep focused on not just their targets, but as Kenya said, what do we need in this province in terms of what we know? And 59% certainly doesn't seem to be enough. As far as we know from FOIPOPs, Freedom of Information requests, and otherwise, there's been only a net gain of maybe 28 spaces. And I noticed in All Nova Scotia, which is a media that has a very hard paywall. So unless you're a subscriber, you wouldn't be able to get access to this. But the last time that they got information from government, they were told that 16 childcare locations had closed. 14 of those were for profit. 11 childcare centers changed hands. 7 switched from commercial to nonprofit. 29 opened or expanded. But in terms of spaces, what we heard was perhaps a net gain of 28 spaces at this point. So we will keep looking for that annual report. Kenya mentioned this report. This is the Canadian Centre for Policy Alternatives Desert Report, just so you have a look at what we were talking about in terms of a desert, which is where, what's the complicated, at least 3 children are competing for one childcare space. This is the the view across the country. And so PEI only has 4%, to as high as 92% in Saskatchewan. I'm also doing the living wage work in Newfoundland and Labrador, and 100% of rural communities in Newfoundland and Labrador are childcare deserts. Next slide. So as Kenya said, for Nova Scotia, at least 52% of young children do not have access to licensed childcare spaces. 47% live in childcare deserts, and 60% of rural Nova Scotians live in childcare deserts. And I thought I'd put that into perspective. So the number of mothers in Nova Scotia with children who are in the workforce, 74% of those with children under 2, and 79% of those with children aged 3 to 5. That sentence should say number of mothers with children who are in the workforce. So if we have 74% and 79%, but we're only looking for 59% coverage, obviously we shouldn't assume that everybody wants to get access to licensed childcare. But as Morna said, as we reduce those fees and make quality childcare more available, the demand will increase. Next slide. And this is from that report. I mean, I think this is where we're at. We're all on the same page in terms of the advocacy that we're looking for. We want our governments to be clear on the targets and on the criteria in terms of expansion, making sure that it's definitely geographically accessible, but also inclusive, and that we're clear what those spaces actually mean, that we address the critical shortages of early childhood educators with good wages and benefits, that we develop this publicly led, proactive, multifaceted, multi-year plan. And Nova Scotia's bilateral was unique in that there was a promise to develop this provincial independent agency. We're still waiting for the agency. We think the agency would be a really important addition that wouldn't just be expressions of interest, putting more work on those who are overworked in the sector to figure out how to expand, but actually that we'd have an independent agency that takes over some of that. And we haven't heard anything. So that is something that we're also looking for. Next. To deliver expanded childcare through the creation of new high quality public services, to make public funds available for not-for-profit childcare in newer expanded facilities, to support the not-for-profit sector's ability to expand, and to not spend public funds on expansion of for-profit in terms of the funding for additional spaces. Is there one more? So that's it.